making the benefits available through CMSP identical to those of the state's other health insurance programs, all children would be able to access the same level of care, regardless of the program through which they receive coverage. That means that children who are ineligible for other public programs but do not otherwise receive or have access to health insurance, in many cases because their parents' employers don't extend benefits to children and families, or they don't offer it at all, these children will receive the kind of quality care that other children are receiving and that they need, and that as a state, we believe all children deserve, regardless of where they come from or what their socioeconomic level is or who their parents are. I want to ask for the committee's consideration of this bill this year for two primary reasons. First, even in difficult times, we as a state should not lose sight of our core values or stop talking about how to move those core values forward, and even when we know that those values cost money. It's important to continue to examine the issues, raise awareness inside and outside of the State House, so that we might be at the ready to take those bigger steps toward justice when we are able. Secondly, I believe that there are ways to amend this bill that would allow for improvements in the program without costing the state money. A proposal set forth by the governor and the House in each of their budget proposals would give the Secretary of EOHHS the authority to adjust the benefits that CMSP children receive, but unlike this bill, would not mandate that those benefit levels be raised. In other words, in better times, the EOHHS Secretary could revisit the issue and make the necessary adjustments, but would not be required to do so now. This proposal would also bring CMSP under the Mass Health umbrella for administrative purposes, which would save the state thousands of dollars in administrative.
I think we all also have to take into consideration the public health climate as well. And as we go into the fall and flu season, and we're looking at the H1N1 virus, commonly known as swine flu, and the prediction that that cases of that would be on a significant rise during that time. We already have 37,000 nationally and over 1,300 in the Commonwealth. I think it's as important as ever that we provide comprehensive coverage to the children under the Children's Medical Security Plan. It's not just those children who are going to be impacted, it's also their classmates, friends, and relatives.
Where we fall short, though, is for those children under security plan, where the limitations of the prescription coverage of $200 won't even cover a month of medication. In a review of the asthma medications on July 1st, 2009, the average controller medicine, daily medication for 1 month, is about $200. And the medications for quick relief medicine range between $40 and $60 for one inhaler. So you can see that the medication, the prescribed benefits are used very quickly. So it doesn't cover much more than a month.
And the safety net is not well served, unfortunately, by CMSP. We are very grateful that CMSP exists. But having this broad coverage that we have for numerically everybody but the 1.2% of kids that are out there is not helpful in those cases where you have increased risk, because those cases need more help for the medicines and the medical equipment and the ER visits. Or else what happens is that their families go into receivership. They have to make untenable decisions about whether they're going to pay for medicine, say, or are they going to pay for food, are they going to pay for rent, are they going to pay for heat. So it has consequences to the family. It also has consequences to BMC, as all of you know. We're in terrible shape. Well, why are we in terrible shape? We're in terrible shape because BMC, for all of these kids with asthma or needing catheterizations, has to provide that care. I'm sure that all of you would do it. If I'm faced with a kid who comes in bad respiratory distress or with a serious infection, you're going to treat them. We all would, right? And the hospital has to. We can't send them away. So the hospital has to eat the cost of the equipment, the medicines, the ER visits, the inpatient visits, the ICU visits, all because we didn't have the foresight in those relatively few kids who are high risk and have chronic illnesses to pay for things that would prevent them from having to go to the doctor, having to go to the emergency